warmly welcome you to the introductory session for the 2022 training course in adolescent sexual and reproductive health for the Eastern Mediterranean region. This training course is organized by the Geneva Foundation for Medical Education and Research in collaboration with the World Health Organization Regional Office for Eastern Mediterranean, that is EMRO. This is the second edition of the course. In the maiden edition in 2021, 177 health professionals from 33 countries were enrolled, out of which 153 completed the course and were awarded with certificates. That is 86% course completion rate. This year, we have so far 315 applicants, and 162 of them from 52 countries have successfully enrolled for the course. A majority, about 60% of these applicants are from the Eastern Mediterranean region, followed by 30% from Africa. A large proportion of the applicants are female between the ages of 30 and 49 years and working as doctors or program managers or implementers. 23 coaches from 18 countries have been engaged to mentor these participants. I will say that WHO EMRO is sponsoring 96% of the participants, and other sponsoring institutions include UNFPA, UNICEF, Pathfinder, Plan International, Engender Health, FHI 360, and Mary Stops. In our midst this afternoon, we have the course coordinators, Dr. Chandramouli from WHO, HQ, Department of Sexual and Reproductive Health and Research, and Dr. Khalid Siddiq from the Department of Healthier Populations, Child and Adolescent Health, WHO EMRO. We also have with us Dr. Maha El-Adawy, the Director, Department of Health Population in WHO EMRO. And members of the, some of the course resource persons I have already, I saw already, Dr. Shatha Nakib and Dr. Madani Belafiani. Maybe others amongst us. I'm not Dr. Anarita Ronzoni and Dr. Bridget. They are probably also with us. And I can also acknowledge the presence of my colleague, Fiona, the course administrator, the GFMER course administrator. This is the session agenda, and after this opening, I would like to hand you over to Dr. Maha for her welcome message. Thank you very much, and over to you, Dr. Maha. I would like to unmute you. Dr. Maha.
Okay, done. Rakiba, so you're putting some strict, very strict measures. I couldn't unmute myself, but so good afternoon, everybody, and it's a pleasure to be with you today. And very special thanks to you, Rakiba, for taking the lead, introducing this session, and many thanks to Chandramouli and Khalid Siddiq, my very dear colleagues, and also to Anarita Ronzoni, who's also online today with us. Dear participants, I really would like to extend a very warm welcome to you to the second training course in Adolescent Sexual and Reproductive Health 2022, entitled Meeting the Needs and Fulfilling the Rights of Adolescents, Sexual and Reproductive Health for the Eastern Mediterranean region. The course is organized by WHO, Eastern Mediterranean Regional Office, in collaboration with our colleagues in headquarters in Geneva and the Geneva Foundation for Medical Education and Research. As you all know, adolescence, which we define as the ages of 10 to 19 years, is one of the most rapid and formative phases of development in humans. It includes distinct physical, cognitive, social, emotional, and sexual development. The capabilities acquired during adolescence determine well-being throughout life, including the capacity to engage effectively in work and leisure, in family life, and in the community. Failure to acquire these capabilities during adolescence can have adverse long-term effects on individuals, families, and communities. Therefore, adolescents require special attention in national development policies, programs, and plans. For years, the unique health issues associated with adolescence have been little understood, or to be more honest, it has been ignored by many. But that has now changed. Adolescent health and development is an integral part of the global strategy for women's, children, and adolescent health, 2016-2030. The inclusion of adolescent health in the global strategy represents a unique occasion to join efforts to ensure that every adolescent has the knowledge, skills, and the opportunities to lead a healthy and productive life. Thereafter, and aiming at operationalizing the adolescent health component of the global strategy, WHO led the development of the Global Accelerated Action for the Health of Adolescents, which we abbreviated as AHA, AA/HA. The AHA guidance aims to assist governments in deciding that they plan, in deciding what they plan to do and how they plan to do it as they respond to the health needs of adolescents in their countries. Dear organizers, coaches, and participants, in the Eastern Mediterranean region, adolescents make up to 1/5 of the population, around 130 million, if not more. The health of adolescents is of utmost importance in our region, given the high rates of mortality and morbidity associated with them. Despite being thought of as a healthy stage of life, there is significant death, illness, and injury in the adolescent years. Needless to say, sexual and reproductive health issues contribute significantly to this burden and are of utmost importance in our region, given the high rates of early marriage, adolescents' birth rates, and harmful practices. Prevailing conflicts and instability in our region do complicate the burden of issues and reduced access to proper services in those settings. The Department of Healthier Populations in WHO EMR gives great attention to the area of capacity building of human resources of member states. Following the unprecedented success, or so we felt at least, and has been actually again also confirmed by Rakibat, that the first course was quite successful. We decided to expand the pool of countries benefiting from this course through engaging a new set of countries. We are so proud to mention that EMRO supported around 100 participants from 10 countries to join the previous training. Participants came from various backgrounds, including medical, academic, program managers, NGOs, NGO employees, and youth activists. Around 95% of the participants rated the overall course as excellent or good in the first one. So in addition, an enormously positive feedback was received during the webinar that was held after the course. So we invited the participants and some of them, those who received awards, and we discussed with them to have genuine feedback, very open discussion in order to be able to feedback into this new course and future courses, hopefully. So it is important to mention that all countries of the 2021 round have identified priority areas now to focus on and are being supported by the Child Adolescent Health Program in EMRO to implement follow-up activities. The program unit is under the Healthier Populations, and that's actually why I'm here. So before giving the floor back to Rakibat, I would like to thank my EMRO colleagues for being part of this, our headquarters Department of Sexual and Reproductive Health, and colleagues in the Geneva Foundation for their efforts to make this training a reality. You know, honestly, this has been very hard, and we have worked a lot to make the first one. I think the success of the first one gave us the energy and the motivation to move forward to the second one, but it really was a bit of a challenge to come to the first one. Sometimes when we say adolescent sexual and reproductive health, we have a lot of negative feedback and people saying we should not be introducing this, but knowing the value and having seen the first round, we are really very proud that we managed to get through this. So I express my sincere gratitude to the renowned group also of experts who serve as regional advisory group for this training. They have all encouraged us, gave us the feedback, were very sincere and candid with us to move us to this stage. And without that contribution, we could not have reached to what we are doing today. Finally, I would really like to thank you all for participating in this training. And I hope you will all remain a helpful asset for our regional activities in the future. This is only a first step. We have 2 months that we are going to be together. So I wish you a very fruitful training journey in the next 2 months. And I hope that we will continue to work together as we move in the future. A very nice welcome to you. I'm so happy and proud to be part of this, and looking forward for your feedback, and hopefully it will be beneficial as it was for the first time. Thank you so much.
Thank you so much, Dr. Maha, for your very warm welcome speech. Before we go ahead to the overview of the course, I would like to recognize the presence of a few of the members of the Regional Course Advisory Group, Dr. Nafisa Badri, who is the Professor in Reproductive and Women's Health and Assistant to the President for Quality Assurance, Accreditation and External Relations, Manager of the Gender and Reproductive Health and Rights Resource and Advocacy Center, Ahfad University for Women, Sudan, and also Ms. Sheena Hadi, who is the Executive Director of Hahong, Pakistan. So you are all warmly welcome. Thank you. So now I will move over to the next item on the agenda, which is to give you an overview of the course. And I would like to start like, as you know, I've already explained in my opening speech that this course, the theme, it's being conducted by GFMER and EMRO. And the theme of the course is meeting the needs and fulfilling the rights of adolescent sexual and reproductive health. I've also introduced to you the course coordinators, and you will hear them speak shortly, Dr. Chandramouli and Dr. Khalid Siddiq. These are the members of the Regional Advisory Group. I've introduced to you Dr. Nafisa Badri, who is with us in this call, and Ms. Sheena Hadi. We also have Dr. Mamdou Wahba. He was present with us during the orientation session for the coaches. He is the president of Egyptian Society for Adolescent Medicine, President Arab Coalition for Adolescent Health and Medicine, and the Vice President, International Association for Adolescent Health. We have Dr. Nadia Bezad, who is the President, Organisation Pan-African de Lutte contre le Sida, Morocco. And we have Dr. Ashraf Badar, founder and chairman of Yemen, country director of Mary Stopes International, Yemen. And the core team from WHO headquarters, Dr. Chandra Muli. And we have external contributors, as I mentioned earlier, Dr. Shata El Nakib, Dr. Madani Belhafiani, and from the foundation, from GFMER, myself and Fiona, the course administrator. And working behind the screen, we also have Professor Aldo Campana. And from the EMRO, we have Dr. Khalid Siddiq, Dr. Karima Gobuzuri, Dr. Narita Ronzoni, she's present with us this afternoon, Dr. Bridget Ngiza, and Dr. Maha El-Adawy, who you just heard speak in the welcome message. These are the course objectives. First of all, to build knowledge and understanding in the following areas. First of all, the rationale for the provision of a package of effective health and social interventions to promote adolescent sexual and reproductive health, to prevent health and social problems and to respond to them if and when they arise, with particular relevance to the Eastern Mediterranean region. And then secondly, the WHO's recommendations for the delivery of these interventions. And thirdly, special considerations in delivering these interventions to adolescents, including in humanitarian settings and COVID-19 pandemic. And also, where applicable, there will be consideration for adolescents' mental health. These are the module topics and the dates. It actually kicked off today with the first module, which is comprehensive sexuality education provision. The second module is contraception, counseling and provision. Third is antenatal, intrapartum and postnatal care. Then we have the safe abortion care, sexually transmitted infection prevention and care, HIV prevention and care, violence against women and girls, prevention, support and care, then harmful traditional practices like child marriage and female genital mutilation, prevention and response. Each module is going to last for 1 week, as you can see from the dates. And then we have 8 weeks of learning in the course. And there's a note that just as I mentioned in the objective, we are going to include approaches to ensuring the continuity of SRH information and service provision to adolescents in humanitarian settings, as well as in the context of the COVID-19 pandemic into each module. Also considerations for adolescents' mental health. This will be integrated into each module. And then what will each module contain? We have 2 to 3 sets of PowerPoint slides with accompanying talking points. You note on the website, we have the PDF. In the PDF, you won't have the talking points. So if to benefit from the messages in the talking points, I will like to encourage you to also download the file with the talking points. Then we'll have a video recording of each presentation and a video recording of an expert commentary. There will also be 2 to 3 required reading documents, 1 assignment. And first, for this course, we will introduce webinars with technical experts. At these webinars, we will collect questions ahead of the webinars from you, related to the topic of the modules. And then these questions will be answered by experts. And we will inform you ahead of time of the dates of these webinars, and we will make effort. We are planning to hold 3 to 4 of these webinars during this course. The teaching and learning methods, and what do we require of our course participants? We want you to connect with your mentor at the start of the course, and whenever you have any need, you reach out to them. Then you also need to complete and submit the end of course survey, evaluation survey. This is at the end of the course, and the link will be sent to you. And then to participate in this course introductory session, and also at the end of the course, we plan to have another meeting with where you will have the opportunity to reflect on the course together with the course organizers and resource persons. And for each module, you should watch the presentations and read the module materials. Complete and submit your assignment by the required date. I believe you must have already received the first weekly schedule with the timeline for the assignment submission. Then we'll expect you to also participate in the webinars, as well as participate in the Google Forum. This Google Forum is a platform that is created for the course, where you can exchange ideas, and also during the course, we will be posting questions. Every 2 weeks, we post questions to stimulate discussion among participants. And these activities we expect to take you between 3 to 4 hours per module. So this is just a slide that tells you how you can join a Google group. We will share this presentation on the website, so you can go over so that you know how to join the group. I believe you must have received the invitation from Fiona. So, and if you have any difficulty, please don't hesitate to let us know, either Fiona or myself. Okay, so also crucial to this course is that we are assigning mentors to each participant, a coach. By now also, I believe you must have been connected with your coach. And this coach will serve as a guide for you throughout the course. They will mark our assignments, and they will provide you with feedback. And then you can reach out to them by email at any time. And in addition, as mentioned before, we will organize online webinars where technical experts will respond to your questions. And then the Google Group Forum, as I earlier mentioned, where you can share and learn from each other. And then finally, you can always contact us at the GFMER Secretariat with any question or concerns you may have. Regarding certificates and awards, all participants who send in their completed assignment by the required date will receive a certificate of completion. And then the top 10 participants will get an additional certificate of commendation and some gift items. So with this, I have come to the end of this part of the presentation. So I would like to hand you over to Dr. Chandra to talk more about the course itself, the topics of the course, and the objectives of the course. Over to you, Dr. Chandra, please. Thank you.
Thank you, Rakibat, and greetings, everyone. So following this introductory presentation by Rakibat on the structure of the course, on the teaching and learning methods of the course, my colleague Khalid Sideg and I will give you a global and regional overview of adolescent sexual and reproductive health. This is to set the stage for the course, and as Rakibat indicated, the first module on comprehensive sexuality education is already online. The next slide, please. So I'm going to take you quickly through some key messages from 2 papers in a Journal of Adolescent Health supplement published in December 2019, which took stock of progress on adolescent sexual and reproductive health in the 25 years since the International Conference on Population and Development. The first paper was aimed at providing an overview of levels and trends in a wide range of factors in ASRHR, adolescent sexual and reproductive health and rights. Next slide, please. So the first point is that there are new demographic realities in the last 25 years. One is there are more adolescents in the world today than ever before, especially in sub-Saharan Africa. There are more boys and girls than boys and young women than girls, boys and young men than girls and young women. That's primarily because of the huge sex selection in some parts of the world, China and India in particular. And this means that girls are killed either at the time they are in the at the fetal stage, or when they are at the child stage, or sometimes even at the adolescent stage. But this is feticide and infanticide, either through acts of omission or commission. And you can see the huge effect of that in countries such as China and in India. Adolescents today are growing up in smaller households. I mean, if you think of how many children your grandparents had compared to your parents, you can see that even at the family level. And they're growing up in the context of increased life expectancy. Even in places like sub-Saharan Africa, as a result of antiretrovirals, the declines in life expectancy have been reversed. Next slide, please. Changing burden of illness. The Lancet Commission on Adolescent Health and Well-being places countries in 3 categories. One is multiple burden countries, where they have sexual and reproductive health problems, nutritional problems, as well as communicable diseases. So you have huge deaths from malaria, as well as from maternal causes, as well as from undernutrition. The second category is injury excess, where some of the declines in deaths due to communicable diseases, SRH, are declining. The third is where non-communicable diseases are predominant, and some of the other areas have become less. I see a comment in the chat. All the materials that we are presenting and throughout the course will be available to you to use in any way that you want. They're all in the public arena. Have a look at this Lancet Commission report. It's a useful document, although it's a little dated now. It's a useful document. Next slide, please. Adolescents are growing up in a different social context. They're more likely to be digitally connected. They're more likely to be enrolled in school and to complete school. They're more likely to be growing up in a context of declining poverty. Of course, this was published before the COVID-19 pandemic, and that has had a huge impact on school attendance, on poverty. Of course, we are all much more digitally connected these days. In terms of rates of unemployment and underemployment, this is higher in young people than in adults, and there is sex disparity, and this is growing among those who are unemployed. Rates of working poverty have increased, and this has only got worse in the context of COVID-19. The next slide, please. The new social context because of COVID-19, I mentioned already, but more likely to be physically isolated from friends, from teachers, and for so many people, so many young people, this is the place where not only is there a chance for socializing, but also a chance to get a meal, a midday meal. More likely to be isolated from extended families, more unemployment, and an increase in global poverty. And what we see is that the countries worst affected and the communities worst affected in those countries are the poorest ones. Take for instance India. Everybody has been affected in this terrible second wave that there was last year, but the poorest communities were affected more. They lost their jobs in the urban areas and had to walk to the rural areas. In many rural areas, there was no access to good quality healthcare. Many poor communities have no access to the internet. So, digital distance education is, only on paper. When you have 4 children in the family sharing one digital device with poor internet access. Next slide, please. There's been huge progress in some areas of adolescent sexual and reproductive health, and that's a very important message. If there's one message that you take away from my presentation today, it is to communicate in all your conversations that there has been progress. We don't talk very much about this. We know that fewer mothers are dying during childbirth. We know that childhood mortality has declined. We know that AIDS mortality has declined. We know that malaria mortality has declined. But we also need to talk about this. Girls and boys are more likely to initiate sexual activity later. They're less likely to be married and to have children before 18. They're more likely to use contraception and maternal health care. They're less likely to support FGM and to have experienced FGM. They are less likely to have sex with a partner who they were not married with or living with. They're more likely to use condoms, and even HIV rates are beginning to decline. So huge progress in all the areas where there has been investment in. No clear trends on unsafe abortion, though we believe that because medical abortion is increasingly available, there has been a decline, but we don't have data. But what we have data for are 2 areas. Sexually transmitted infections are increasing everywhere. And intimate partner violence and sexual violence is increasing everywhere. And the COVID-19 pandemic has just worsened this situation for violence in the home. Violence, corporal punishment of children because parents are in conflict and parents are going through difficult financial times, but also, in the context of a marital partnership or a live-in partnership. Next slide, please. While we talk about progress, we have to talk about inequities. We will talk about this through this module. Even in the richest countries of the world, there are inequities. And I talked about that in the context of COVID-19. And we shouldn't forget this. Child marriage rates are declining, but where rates are high, they are in poor communities and in the context of humanitarian conflict. Next slide, please. Last part of my presentation will touch on the humanitarian context. I'll come to that. The paper 4 in this Journal of Adolescent Health was looking ahead. What are the opportunities we must leverage and what are the challenges we must navigate? Next slide, please. The opportunities, the challenges are listed on this slide. Denial of adolescent sexuality, gender inequality, resistance to engaging adolescents meaningfully, weak systems and weak integration and coordination across systems, changes in population dynamics and family structure, which means that, the safety net that families provide is less. In many communities, it is single parents bringing up children in a world of growing urbanization and in an increase in humanitarian and climate crisis. Next slide, please. Emerging opportunities are inclusion of adolescents in global, regional, and national agendas. In the Sustainable Development Goals, adolescents are at the center of the agenda. Increased investment. We have money now for child marriage, for contraception, for HIV. Renewed commitment to universal health coverage, increased school enrollment, sadly undermined by COVID-19 and advances in technology. So huge opportunities that we must leverage. Next slide, please. The last 3 slides of my presentation deal with SRH in the humanitarian context. And thank you, Shata and Madani, for putting this together. Shata, would you like to speak to this slide, these 3 slides, please? Over to you, Shata.
Oh, thank you. Thank you, Rakiba. Thank you, Chandra. Yes, so as you all know, in the region, humanitarian crises are, the impact of humanitarian crises on adolescent health is particularly salient because the region is a hotspot for conflicts and for natural disasters. And we know that in humanitarian contexts, adolescents are often overlooked. So across the globe, there's around 68.5 million forcibly displaced people. So these are refugees or internally displaced individuals. And a big proportion of these populations are in the Eastern Mediterranean region. And because we have the largest generation of young people in the world today, and because children and adolescents represent around 47%, so that's almost half of UNHCR's persons of concern. So these are people who are forcibly displaced. There are increased vulnerabilities that come with the context in which many adolescents are now growing up in, right? So they're growing up in contexts where there is a breakdown of social and cultural systems, there is increased exposure to armed conflict and violence, there is personal trauma, which carries a lot of mental health consequences, school closures, absence of role models. And a lot of these issues have relevance to the well-being and SRH of adolescents. So for example, because of this context, adolescents grow up with lack of basic information on sexual and reproductive health. They live in contexts where there is disruption of health services. They're more likely to experience early and unwanted pregnancies, have a high risk of contracting STIs and HIV, and just a slew of other vulnerabilities that adolescents experience because of growing up or because of living in the context of humanitarian crisis. And we do know, next slide please, we do know that there are particular, sorry, the one after Rakibat, there are particular challenges with looking at adolescent SRH in emergencies. And some of these challenges relate to the dearth of data, the absence of data on adolescent SRH. We don't have enough sex and age disaggregated data. We don't know what age categories, there's still lack of consensus and global agreement on what age categories we should be using to collect data. And so because of this lack of data, sometimes the needs of adolescents are overlooked or they're rendered invisible. So these are some of the issues that are going to be highlighted in the modules that are about that are part of this course. Over to you, Khaled.
Thank you. Thank you, Chandra and Shiva, for giving us the global perspective of adolescent sexual and reproductive health. And first, let me take the opportunity to thank all of you colleagues as the part of the organizers and contributors from Geneva Foundation, our colleagues in HQ, our external contributors who are present. and also to thank our regional advisory group. And I learned that we have both Sheena and Prof. Nafisa with us. So I welcome them all, and also warm welcome to my colleagues in EMRO, although with the lockdown and the minimum work, modalities, we don't see each other. So I also welcome Dr. Karima Gubzuri and Dr. Anarita Ronzoni, and also thanks to them for being here. They are part of the regional core team. And I would like to thank all the participants for considering applying for this training, and also for being with us, which shows the commitment they have from the start. I'm going to give you a very brief overview of the situation of adolescent sexual and reproductive health in the Eastern Mediterranean region, with the aim of providing an overview of the adolescent health status in EMRO, and trying to contextualize the issues of the training. Next, please. Let's start with the constitution of adolescents to the overall population. As mentioned by Dr. Maha in the welcoming remarks, we have almost 20% of our population in the region are between the age 10 to 19 years old. This is the regional average, but we can see per countries there are a bit of variations. We see in countries like Sudan, like Somalia, and Afghanistan, Yemen, and Iraq, the proportion is a bit more than 20%, and it reaches 25, a quarter of the population in Somalia and in Afghanistan. We talked about the importance of humanitarian settings from the global perspective, but as we all know that when it comes to the region, this is even more important to us, having more than 50% of our countries in the region. As you may know that the Eastern Mediterranean region comprises of 22 countries. Almost 11 of them are either directly or indirectly affected by conflicts and instability. So this issue of humanitarian settings are of utmost importance for us in the region. And we have almost 50%, half of the population in need for humanitarian assistance in the AMR graded emergencies, and these are mainly displaced population. Almost half of them are below 18 years, which comprises both child and adolescent. And when you see at the numbers in terms of millions of children, we have quite a significant number of it reaches like 30 million in total in EMR emergency graded emergencies, which is quite a big number. You can imagine the burden resulting from that. Next, please. This is slide showing the mortality rate per 100,000 population in 2015. This is data back to 2015, and the data here is showing the mortality rate in low and middle income countries per each region. We see in our region we are the second highest after the African region, with 115 deaths per 100,000, which is quite high one. We are above the global average, which is at 101. Next, please. This is most recent data, 2019, and here it shows us by sexes, males and females, and this is the overall for the whole population of the region. And we see almost consistently across the age groups, either 10 to 14 or 15 to 19, or the overall 10 to 19, mortalities among males are higher than females. And this is mostly attributed in recent years to the prevailing conflicts, instabilities, and wars in the region, where we see in many cases males from 15 to 19 years, and sometimes even at lesser age they contribute to the war, and they are victims of these wars and conflicts. Next, please. This is the mortality rate broken down by countries, and also we see how different the mortality rates in their countries, and this brings me to what Chandra mentioned about equities and inequity issues across the region and sometimes within the countries. We see in our region, in countries like Somalia, Yemen, Afghanistan, Syria, Pakistan, we have really high mortality rates across 10 to 19 years old, while we see in other settings in Gulf countries or like Tunisia and Morocco, we see very much less mortality rates. And I'm really glad that in this training course we are having diverse backgrounds of participants. We are having participants from Bahrain, Qatar, United Arab Emirates, and at the same time we are having participants from Somalia and from Pakistan. So it would be a good platform to exchange experiences and to share issues across the different backgrounds. Next, please. People they die in those big numbers, but what are the causes? They are just giving here examples of the age 15 to 19 between males and females. When it comes to the males in this age group, road traffic injuries stand as a very big contributor to the deaths in our region. And this is followed by violence in terms of interpersonal violence and self-harm, and some diseases like diarrheal disease and tuberculosis are still contributing to high deaths among our adolescents in this age group in the region. While for females, the next slide. For females, unfortunately, maternal conditions still are coming at the highest place because it's the death is more than others for the 15 to 19 years old females in our region. And as we all know, most of them are very much preventable causes of death, and they are very much relevant to the topics discussed in this training course, and you will see how they are being addressed during the training. Whenever topic we have, it has something to do with mortality and morbidity in the region. But still we have the same issues for males like tuberculosis, diarrhea, road injuries, and self-harm. They are still also available here for females. Next, please. One of the key indicators we are using is adolescent fertility rate, and we opted to portray this slide because it is very much relevant to the training course. It's adolescent sexual and reproductive health, and you will see it actually in the when we talk about several modules. You will see this slide again and again, and it shows the fertility rate per 1,000 girls in the age 15 to 19 years. We see in 4 countries we have fertility rate which is more than 60, ranging from 60 to 100, and this is mainly in Sudan, Yemen, Somalia, and Afghanistan, followed by countries like Egypt, Iraq, Syria, Pakistan, and Palestine, which also they have high mortality rates, and it comes down when it comes to the Gulf countries and Lebanon, Libya, Tunisia, and Morocco. Next, please. Another very important area to address in our region is child marriage in the Eastern Mediterranean region, and it is increasing the trend of early marriage in the region, and this was affected mainly by the conflicts and instabilities over the past decade, and the region is a home for nearly 40 million brides. And around 15% of the girls in our region, they marry before age 18, and 2% of them married even before age of 15. In countries like Sudan, Somalia, Yemen, and Iraq, we have the highest number of women who are currently aged 20 to 24, but were married or in union before the age of 15, which is significantly high figure, and we will be having a standalone module to discuss the area of child marriage and how to alleviate this issue in the region. Next, please. In 2018-2019, WHO conducted a policy survey covering sexual, reproductive, maternal, and neonatal child and adolescent health. And quite a good information came out from this survey. But unfortunately, it also opened our eyes to the gaps that we have. In the region, we have the lowest availability of national standards of delivery of services to adolescents. We have almost like a quarter of our countries, they have these standards, and we were actually the lowest region as compared to other regions of WHO. We have national adolescent health programs exist in around 2/3 of member states, and this is actually a good baseline to build on, and we can work and invest on strengthening the existing programs and also to build new programs where we don't have. Next, please. I think this is the last slide I have, which is about the regional opportunities. In addition to what has been mentioned earlier about the global strategy for women, children, and adolescent health, and also the response to COVID and so on, we have several initiatives. We think that they are representing good opportunities for us at the regional level. The first thing is the operationalization of the Accelerated Action for Health of Adolescents, the AHA. It operationalized the adolescent health components of the global strategy, and we took it forward in the region, and we had the resolution in 2018 urging all member states to develop their own adolescent health national strategic plans and policies. And now we are building on that commitment, and we are renewing the progress and monitoring the progress made for these commitments. We are also having recently the regional implementation framework for newborn child and adolescent health 2019-2023, which is built on both the global program of work number 13 and also on the regional vision of our regional director vision 2023. And again, similar to the AHA, in 2019, during the regional committee with the presence of almost all the ministers of health, they endorsed this implementation framework. And this implementation framework, we think that it represents an excellent opportunity to advance and promote adolescent health agenda at country level. In addition to that, we have a very important tool which you just developed and launched last year, which is the Regional Operational Guide for Child and Adolescent Health in Humanitarian Settings. As we mentioned before, humanitarian settings are very important for us. We have quite significant number of adolescents living in humanitarian areas. So we thought that providing a programmatic guidance on how to integrate adolescent health issues and providing a step-by-step guide to help program managers to deal with this area of work will be of help. Next, I think this is my last slide. I would like to thank you again, and I wish you all successful training ahead. Thank you. Back to you, Rakita.
Thank you very much, Chandra, Khalid, and Shata for the overview of the course. I believe the next item, although we are running behind time, but I believe we can hear from the members of our advisory group, just a few words from them. So if they would like to. So yeah. Dr. Nafisa, would you like to say a few words, please?
Good afternoon, everybody. Thank you very much, Ragibat, for this opportunity. And thank you to the WHO for bringing us on board on this very important initiative and very vital one. looking at the statistics that were just presented, it makes one wonder, although there was a mention that there is a lot of progress going on, but it just shows us that there is still more work to be done, and we really need to engage all sectors. And I'm so glad that we have participants from all different countries, and I hope by the end of this 2 to 3 months, we will end up with very strong initiatives that can really make a difference for adolescents in our countries, especially those who are living under very severe situations and humanitarian settings. So thank you very much for this opportunity, and I look forward to continuing with the participants and the team. Thank you.
Thank you so much, Dr. Nafisa. And also here is, if you would like to say a few words, Sheena. Sheena, would you like to say a few words?
Yeah, sure. Hi, everyone. Thank you. Just echoing the sentiments that were shared by Dr. Nafisa and Chandra and Khalid. You know, so I was worked on the first version of this, which was, you know, rolled out some months ago, and I think that it has a really valuable place right now. I think as the more and more emphasis is given and understood of why we need to focus on adolescents. I know that's the case in Pakistan, where we talk a lot about young people and adolescents. But then when it comes down to it, there's so much paralysis around actually knowing what to do and how to do it because of fear and stigma and other issues, even when we have a lot of the data in front of us and we know what a lot of the advantages are, particularly of things like CSC programs. So I think this is really valuable, and you know, I'm very honored and excited to be involved again. So good luck. Thanks.
Thank you very much, Sheena. And I can see Dr. Madani's hand is up. So over to you, Madani, you can say a few words. Thank you.
Thank you very much for my colleague for this presentation. I want to add something that this courses has been updated and enriched with the recent data to promote adolescent sexual and reproductive health, and in order to respond to their needs, particularly in the EMR region, and also for delivering intervention and adolescent in humanitarian setting and in this COVID pandemic. I think this courses will be of great benefit for the participant, and I wish all the success for the participant, and good luck. Over to you.
Thank you very much. Thank you very much. Before we call it a day, I would like to acknowledge that many of or most of our coaches are also present here this afternoon. And I can also see Dr. Wahba, who is a member of the Regional Course Advisory Group. I introduced him earlier. Dr. Wahba, I don't know if you would like to say a few words before we call it a day.
I would like first to thank everybody of the team, Chandra Moli in Geneva and Rakiba in Geneva, Regional Office Khalid, and we don't have to forget our friend Jamila, and now we have Shaza and Madani with us, everybody in the wonderful team. And this is I think this initiative is very well needed. And the feedback that I personally got after the first round of the initiative was very, very positive. They benefited so much, and it's true. We have a lot of challenges in the region for adolescents related to sexual and reproductive health, taking the special and distinct character of culture of the region, and at the same time, we don't have much numbers, we don't have much research, and we don't have much health providers who can provide quality services to our young people. It's wonderful to have the second round, and again, thanks for all the team, wonderful team, and all the best for our colleagues who participated in this course. Thank you so much.
Thank you so much, Dr. Wahba. I didn't see many questions in the chat box from our participants, but in any case, if you have any question or concern, please feel free to contact myself or Fiona. And before we round up today's meeting, I would like to call on Fiona to please give a vote of thanks. Over to you, Fiona. We cannot hear you, Fiona.
Okay.
Yes.
Got it. Hello, everyone. I'm Fiona, the administrator of the course. On behalf of GFMER and WHO EMR office, I would like to say a big thank you to everyone present here today for the course opening. Our participants, our coaches, and Dr. Maha, the course coordinators, members of the course advisory group, and all the course resource person. Thank you. You have taken time from your busy schedule to join us, and we are really appreciated. Thanks WHO and the advisory board who spent a lot of efforts in updating the course materials and prepare most recent case study and resources for us. Thanks our participant for applying the course, and we hope that you will enjoy this 8 weeks online training course and enjoy this learning journey. And thank you for our coaches to support GFMER and to facilitate and motivate our participants to maximize the benefits from taking the course. I would like to thank you everyone and WHO, EMR office and other sponsors. The sponsorship provided has made it possible for many participants to join the course. And I would like to request our participants to please make maximum use of this sponsorship. There are many other applicants who could not enroll due to lack of funding. So we hope that as many of them as possible will eventually get funding to join the course and complete the course. So at the end, whenever you have questions, please feel free to contact us, Rakiba and I. We will be here with you. Thank you, everyone, and have a very nice day. Thank you.
Thank you, Fiona. And this brings us to the end of the meeting. So thanks, everyone, again, and have a good afternoon. Bye-bye.